So the new update now is that you can work more than 20 hours on your second job. If you recall, last year, it was middle last year, they said UK government updated their website and said that people are no longer allowed to work on a second job for more than 20 hours a week. So they also said if you must work more than 20 hours a week, you need to update your visa. This applied to everyone, no exception, both students, both people on tier 2 visa, but now it has been reversed. So from now till August 2023, you can do more than 20 hours. I think that's a good news, because one of the problems people face in the UK is restrictions. When you are restricted to work a certain hour, I mean, you know there is job, you know you can do this job, but you are restricted. I mean, we are happy to pay the tax, aren't we? I mean, we don't have a choice, we have to pay the tax, right? But you know, when you are restricted from doing this work, it makes you like it's so heartbreaking. But the good news now is it's been removed. Hello everyone, my name is Queen Darlene Aniako, and if you are joining me for the first time, you're welcome to my YouTube channel. Please do relax, sit down and relax. And to my returning subscribers, you guys are the big deal. I mean, you are the real deal. I love you guys. All right, so that being said, I'm going to tell you about this visa, this 20 hours rule. You know, before COVID, you are only allowed to do 20 hours a week on a second job. Your second job includes your bank job. It also, you know, when you're doing bank shift, yes, it also includes working as an agency or working with an agency. It involves doing any other work that is not included in your visa. And then during COVID, because of pressure, because of stress on the healthcare system, they removed this law so that people can be able to work more, because a lot of people left work. In fact, you know the story. But now, last year, they brought this rule back. And people have been complaining, not just people complaining, there is still stress on the healthcare system, because almost virtually all the healthcare system lacks staff. They are all short staff. So in order to improve this short staffiness, if there's any English like that, in order to, you know, reduce it, they have reintroduced this law, but there is a clause. There is a clause. I mean, UK cannot give you something just like that. Just know it. Anyway, this is not for everyone, and I'm going to read it for you directly. They're taking on additional work. You can do additional paid work on a health and care worker visa, as long as you're still doing the job you're being sponsored for. You can also do unpaid volunteer job. You may need to apply for to update your visa to do additional paid work. So basically, in their website, when they stopped, you know, before COVID, you can only do 20 hours, and then they removed this restriction, and then last year they brought it back. So they said that for you to be able to do more than 20 hours, that's after they brought the restriction last year, restriction of 20 hours a week rule, you should have you should update your visa for you to be able to do more than 20 hours. So that's what they are saying here. But now they say they have changed it again. So that is what we are reading. You may need to apply to update your visa to do additional paid work. This will depend on the type of work you are doing and the hours you are going to work. So this is what brought us here now. Work you can do without updating your visa. So for you to do more than 20 hours without updating your visa, the works you can do, if your extra job is also eligible for a health and care visa, worker visa, you can work as many hours as you like without updating your visa. So you see, this 20 hours rule is, I mean, they put it on all tier 2 visa, but now they are lifting it for health and care worker visa alone. Are you seeing it? If your job is not eligible for health and care worker visa, you can still work up to 20 hours a week if the job is on a shortage occupation list. Updating your visa. You need to update your visa if you are going to either get a job that is not an eligible health and care worker visa job, or in a shortage occupation list. If you're going to work more than 20 hours in a job in a shortage occupation that's not eligible for health and care worker visa. I don't know if you understand this one. So these are the jobs that are eligible for health and care worker visa. So these are jobs that can actually do more than 20 hours. You're a qualified doctor, nurse, health professional, or adult social care. Adult social care, they include the care assistants, the social work, and all the social workers, care support workers, and all those people. So your job is eligible for this visa. You'll be working for a UK health and care sector employer that's been approved by the Home Office. You'll be paid the minimum salary or the going rate for the type of work you'll be doing, whichever is higher. So these are the jobs that must be in the health and care. See it. Your job must be one of the following occupation codes to qualify for the health and care worker visa. You have to be a health services and public health manager and directors, residential day and domiciliary care managers and proprietors, biological scientists and biochemists, physical scientists, medical practitioner, psychologists, pharmacists, ophthalmologists, ophthalmic opticians, dental practitioners, medical radiographers, podiatrists, health professionals that are not elsewhere classified, such as the care workers and home carers and senior care workers. So the approved UK health and care sector employers, you must have a job offer from an approved UK employer before you apply for a health. This is actually the process of how to get the job. But remember what we're talking about. For you to be able to work more than, Jesus, I hope I'm not too fast. For you to be able to work for more than 20 hours, you must have a job offer from either the NHS or an organization providing medical services to the NHS. So any agency, like for nurses and doctors, any agency you work with, as long as they send you to go and work with NHS, you can do more than 20 hours. An organization providing adult social care. So if you are working in a care home, you fall under this. So it's basically saying that if you fall under a health and care visa, which are the ones I just mentioned, okay, and if you work for a government or UK approved healthcare provider like NHS, social service care, or you work with the agencies that provide staff to NHS, like agencies and nurses, we know all these agencies. If you work for any of them, you can do more than 20 hours. But from August 2023, you will need to update your visa for you to be able to do this. So what are you waiting for? Anyway, so this is an update, and I hope you understand everything. If I have any question, just drop it and let me know. Thank you for watching. And so from what we've read now, please don't make mistakes. And now, before even this law, people used to complain that it affects them applying for their PR and all those things, but I don't think it's going to be a problem anymore. I don't think so. So thank you for watching, and do remember to share. I don't know if it applies to students, but yeah, we are going to find out. So keep still, stay in this channel, and please remember to subscribe, and bye.